Hi, Andy. Welcome to the show. I am thrilled to have you joining us. Thank you so much for being here.
Yeah, thanks for having me.
Yeah, this is super exciting for me as I was kind of chatting with you before we got started because this whole entire topic, or I should say, your company, has been such an answered prayer for me, and I happened to hear you on another podcast, one of my very favorite shows, Designed to Heal with Dr. Ben. And after I heard you speak on his show, I was like, I need to get in touch with him. So I'm so glad to have you so we can, introduce probably a lot of new information to our listeners and let them know about these other options. So, again, thank you so much for being here.
Yeah, no problem at all. We'll have
Yeah,
some fun.
we are. We're going to have fun. I can't wait. So, let's start with a little bit of your background. Why don't you give us a
Mhm.
little bit of insight on why you're doing what you're doing? Why did you even go down this road and start this company? And what led you to CrowdHealth?
Yeah, great question. I this is actually my second healthcare company. So I ran my first company for about 10 years and sold it. And given most of us get our health insurance through our employer, given I just sold the company, I didn't have healthcare anymore. And so I went on to healthcare.gov because I thought it was my only other option. And I got a plan for me, my wife, and my two girls. And I think it was 11 or $1,200 a month or something like that. And I kind of joke, it worked until I had to use it. My little one, who was one at the time, was having recurring ear infections. And so we went to the pediatrician, and pediatrician's like, oh, yeah, she's definitely got ear infections. And, you're gonna have to go see an ear, nose, and throat doctor. And what, she explained to me is, with little kids, oftentimes they get these ear infections. And so all of this, fluid builds up in their eardrum and eventually it bursts. And so, and that's where the pain is coming from. And so we went to the ear, nose, and throat doctor who's like, yeah, she's got a burst eardrum, a perforated eardrum. And so what they're going to need to do is stick these little plastic tubes in her ears to let that fluid drain out so that it doesn't put pressure on her eardrums because over a period of time that creates scar tissue and then impacts her ability to hear. And so he was so concerned with it, he actually delayed his vacation by a day to do the procedure. And so we went into the only place in town that was in network with my plan, got it done. It was about a 15-minute procedure. And then we got the bill and it was $8,000. I'm just like, wow, $8,000 for 15 minutes. Like, this is craziness. Um, but I was like, this is what health insurance is for. Like, this is the whole point of having health insurance. And so didn't really think much of it. And then I got a note via snail mail a few weeks later from my health insurance plan that said it was medically unnecessary, and so they weren't going to pay for it. I'm just like, wait, hold on a second. Like, my daughter's got a hole in her eardrum, and you're telling me this is medically unnecessary? And so we went through multiple rounds of appeals with the health plan. At the end of the day, they're like, nope, we're not paying for it. And so I had to stroke an $8,000 check to pay for this procedure. And as you can probably imagine, I was ticked. And so I called the health insurance plan and I said, hey, listen, like, if you guys aren't going to pay my bills, then I'm not going to pay your bills. And so I quit. And so I was basically uninsured at that point. And so my wife was kind of like, okay, so what do we do now? And I was like, we're going to figure out how to operate without having health insurance. And as I started doing some research, I realized that about 2,000, or excuse me, 200,000 families every year go bankrupt due to a health event, even though they have health insurance. And so, it's just this crazy system that we're in that I just couldn't believe. And I was like, somebody's got to do something different. And so, over the next 18 months, 2 years, something like that, I started building some tools that would allow me and my family to operate outside of health insurance. And that culminated into my current company, CrowdHealth. We started CrowdHealth in 2001. And so we've been at it for about 3.5 years now and have almost 10,000 people who are in the community who are all funding each other's healthcare expenses. And that's where I'm at today. But yeah, I mean, many times these new companies are born out of, affliction in some ways or another. And, Crowd Health is just one of those. I swore to myself after my first healthcare company that I wasn't going to do healthcare again. It's super regulated, it's super bureaucratic, it's hard to operate. A lot of the decisions that are made within healthcare don't make any logical or economic sense. And so I was like, I can't operate within that anymore. But I apparently, God had different plans for me, and here I am. 3.5, or I guess almost 4 years into CrowdHealth. So it's been a fun journey.
Wow. Wow. I love that. And I love that you said, things that are, well, I'll use my words, but things that really are great and like they're born often out of affliction. I mean, I know that firsthand as well. And it's sad though, right? That we have to sort of go through this whole like tribulation process to sort of like get to the other side of things when it comes to healthcare. And unfortunately, it's like that, for so many people, they sort of wake up out of this programmed slumber that they've been in because they're sort of just walking to the beat of this drum that just because
Hmm.
it's all they know, right? That's all they know is like the conventional paradigm or the standard traditional health insurance. And I feel like if they knew what was really going on behind the scenes and knew what their options were, then there would be other decisions that would be made. Do you know what I mean?
Yeah, totally.
Yeah.
Yeah, unfortunately, just in our broken human nature, we have to get slapped upside the head sometimes for us to actually make, better decisions because we get lulled into this place of just accepting the status quo and assuming the status quo is going to work. And I think that's what's happened with health insurance is everybody just thinks that this is supposed to work when I have a big health event that they're going to pay for it. And in fact, that's just not the case because, with healthcare.gov, I found out is 1 out of every 6 bills are declined by healthcare.gov plans. And for United Healthcare, the last graph that I saw was 1 out of every 3 bills were declined. And so, what a lot of these health insurance plans do is they just decline the bill and then, just and assume that you're going to be lazy and then not appeal it. And if you don't appeal it, then it just goes, and that's the way that they make their money. I mean, it's kind of goes back to the perverse incentives of health insurance plans.
Yeah.
They actually have an incentive to decline your bills. And so I'm like, I don't know why people, now that I'm kind of on the other side of health insurance, I don't know why people get into bed with a company that actually does well when you don't do well. Like that just seems like it's not aligned goals, not aligned benefits. And so it's what we're trying to do here is align our goals, our profit, if you will, because I'm a for-profit organization, with the health of our customers, and that's just not the way that health insurance works. So, happy to go into that more, but that's what people don't fully understand is that they benefit from you being sick. They benefit from you getting your bills declined, and that just seems like a very perverse way of going about healthcare.
Yeah, I do. I would love to go in. I think two parts. Like let's because before we talk about crowd health and sort of how it works, I do want to first of all sort of go into this whole area of I guess number one is why do you think that there's so much fear surrounding not having this traditional health insurance plan, right? Whether it's like Aetna, Blue Shield, United, and then also I think and however you want to take it, just let's just go with it. Why is there so much like I hate to use the word misinformation, but we are so misinformed. Like the general public is so misinformed about what's going on because people are like, oh yeah, like my healthcare is so cheap because my copay is only, $15.
Yeah.
But what they don't know is what's really going on behind the curtain with the premiums and whether it's them or the employer and like how it is so inflated in so many different ways. And so it's really not cheap, quote unquote, like they think that it is, and just everything that entails. I mean, when I woke up to this a long time ago, I was like, no way, like this
Hmm.
cannot be this corrupt and this scammy. And I realized, uh, several years ago, like this doesn't even align with my values, like this isn't even
Right.
like morally this does not align. But I had it took me a while to pull the trigger, like I was telling you off air. But I just kind of want to like sit here for a minute and discuss, and like I said, wherever you want to go with it, please just go with it because I think that you've got a lot of good food for thought here.
Yeah, I mean, I think we just have been conditioned, and I would even kind of go to the extreme and say psyoped into thinking that health insurance is going to be your savior. And I just the more research I do, the more I understand what's going on behind the scenes, the more I have, come to the conclusion and have a lot of conviction in my conclusion that that is not the case. Like I said, just these there's so many bills that are declined. We unfortunately saw this play out with, the United Healthcare CEO at the end of last year and Luigi. And we're seeing it with lots and lots of people being very upset with the fact that they set an expectation that your bill is guaranteed to be paid. Health insurance plans can actually guarantee that your bills get paid legally, but then they don't actually get paid. In my state alone, the state I'm in Texas, the Blue Cross Blue Shield of Texas had 20 million claims in the last year that the data, I think it was 2022, and 4 million of the 20 were declined. And so, that's a 1 out of 5 chance. And it's just like, man, I don't want to take a 1 out of 5 chance, especially when it's a really big bill. I mean, I got hammered for $8,000, and I've been extremely fortunate. I can pay the $8,000. It clearly hurt, but the vast majority of Americans don't have $8,000 to pay for a fairly benign, surgery that took 15 minutes. And so that's where I think the tragedy lies, is so many of these people are going into financial distress as a result of relying upon their health insurance plan, because the vast majority of Americans don't have $1,000 to their name. They don't have $1,000 of liquid assets that they can use to pay for some of these big expenses. So, the denial is on one side, but then as premiums have gone up, they're trying to reduce premiums, which is, what you pay on a monthly basis. And so instead, what they've done is they've let deductibles go up. So I was doing just a quick, curiosity check on healthcare.gov for me and my family this year. And I was going to be paying like $1,300, and I think it was a 17 or $18,000 deductible, which in essence means that I'm paying, 30 some odd $1,000 before the health insurance plan pays a dollar. And so people have to realize that they are on the hook for the first $35,000 of their health bills in essence. And people just don't fully understand that math. And so that's where I think some of the misinformation is coming from, is just not realizing that they are on the hook for a lot before the health insurance plan will step up and pay anything. So those two things I think are really leading to the bankruptcy numbers that I just mentioned. The other thing too that I think people don't realize is, like I said earlier, it seems somewhat counterintuitive that health plans actually want you sick. And I would expand it beyond health plans. I call it the medical industrial complex wants you to be sick. And it makes sense that the pharmaceutical companies want you to be sick because they get to, sell you more pharmaceuticals. It makes sense that the hospital systems want you sick because you're in the hospital more often. They make more revenue. What people don't understand is health insurance plans actually make more money when you're sick. And so let me explain how this works really quickly. And it's pretty easy math, but the Affordable Care Act basically said that the health insurance plans are maxed out on their profit per year. With the idea here is that they don't want health insurance plans screwing over consumers. So what they did is they said max of 15% you can use for your administrative costs and profit. So if my premium is $1,000, the max they can use is $150. And so how do they get the 150? These are for-profit organizations, most of them. How do they get that 150 to grow 10% to 165? Well, your monthly premium has to go from $1,000 to $1,100. So they actually have to, premiums have to go up and to the right for these health insurance plans to make the profit that they want and to pay the people that they want. So, imagine if it went down 10%, if it went from $1,000 to $900, then the most that they can take is 15% of $900, which I'm not going to be very good at the math, but whatever that is, $130, as opposed to 155. That means they have to cut staff, they have to cut salaries, they can't take their big broker of the year trips to the Four Seasons in Hawaii. Like they actually have to cut back, and so there's no incentive for health plans to see premiums decline. And so when people say, healthcare is so confusing, I'm like, no, it's not. It's not confusing. You have the buyers of healthcare, which are health plans. They want the price to go up. You have the sellers of healthcare, which are these big hospital systems, pharmaceutical companies. They want the price to go up. And so when you have the buyer and the seller of a good wanting the price to go up, guess what? The price goes up. And so that's why we're getting, out of control, healthcare costs in our country is because pretty much everybody in the system wants the prices to go up. And we as consumers have very little ability to, be the invisible hand, if you will, to knock those prices down because we ultimately aren't paying for it. It's the health insurance plan that's paying for it. And so we just don't really even care most of the time what the price is. So that's the challenge. The thing I tell people is like, if you're not paying for the service or you're not paying for the product, you are the product. And so
Yes.
within our healthcare system, we are the products. Everybody's making money off of our health. When in reality, what should be happening is I should be making money off of my health. If I'm healthy, I should be paying less. If I'm not healthy, I probably should be paying more. And that's just not happening within healthcare currently.
I really like how you just described this because it kind of parallels what I was thinking to ask you or mention is that I think that a lot of people or most people think that they are the customer. Like the members are the customer, but the members aren't really the true customer of
No,
their doctor, of their of the hospital, of whatever they are at, a care center of some kind. It's they're not the customer, right? Like it's the insurance company that's
right.
the customer. And so
Yeah.
they don't have nearly as much power. And I think that there's just, like you said, it's almost like a psyop to think that they're getting the good end of the stick. Like, well, it's so cheap for me. Or, it's like, well, I pay only $5 for my service or my labs or, but it's not that. Like they're just not seeing the whole entire math equation in the background. And, it's like even with employers who are paying, people who are on have benefit plans through their employers, they might like for them and their family, they're like, oh yeah, cool, like $150 being taken out of my check, but that
Yeah.
employer is paying a huge amount of money.
Huge, huge. It's
Huge.
it's something like $24,000 for a family. I think it's
Yeah.
six or $7,000 for an individual. And so your employer is paying that. I mean, people think that, oh, my employer is paying that, and they are, but it's on the salaries and benefits line. So what they're paying towards health insurance, they're not paying you directly. So you are indirectly paying for it. You're just not
Yeah.
getting the salary. And
Right.
so that's the challenge. I mean, I think you hit it on the head, which is we're not the customers. Here's my iPhone, right? A beautiful, piece of technology with most of the time great user interfaces and great user experience. And so why is that such a great user experience? Well, I'm the customer. If I don't like the user experience, I can cancel. I can go and get an Android or, whatever. And so that's the beauty of when you're the actual customer paying for the product. If you get an explanation of benefits in the mail, which, if you're on health insurance, that's what happens, right? Something happens, they send you an explanation of benefits. It's supposed to tell you what the health plan pays and what you pay. And it was a funny conversation I had with my buddy who was my roommate at Stanford, and he was like the number two person in our class, like a wickedly smart guy. And he's like, you know what? The one thing that makes me feel like an idiot in this world is health insurance. Like I don't understand it. And these explanation of benefits you get in the mail, the math doesn't even add up.
Yeah.
And so why is that, right? Because you're not the customer. They don't even really care. They want to confuse you.
Yes.
The customer is the employer. Because you can bitch and moan all you want, but guess what? The customer is ultimately your employer. It's not you.
Yeah.
They don't need a great user interface for you. They don't need a great user experience for you, because you're not the customer. You're actually the product. And so that's the challenge that we have with our healthcare system. And that's why it's so complex, is because it's not a B2C relationship. It's a B2B relationship. It's between your health insurance plan and your employer most of the time. And even when it's a B2C where I go on healthcare.gov, I can't leave, like, what am I going to do? Like,
Yeah.
I can moan and groan and complain, but they're kind of like, you're kind of stuck with me for the year. So, it's just, there's no incentive to create a great user experience for the customers. And, because they're not the customers.
Yeah. Yeah. Could you could you give an example of how the cost of procedures or labs or, really anything, I guess, I don't know, I feel like everything are inflated and much higher in reality than cash prices if you were a cash patient?
Oh yeah. I mean, this is the entire foundation for which
Yep.
CrowdHealth is
Yep.
is built upon.
Yeah.
One of the things I realized when I started doing my research after becoming uninsured is like how much does it cost if I go and just pay it by myself? And time after time after time, it was like significantly less if I paid in cash. I mean, I'll give you an example. Like literally today, hopefully my wife doesn't mind, but she went in for her mammogram screening. Like, she does it she's got some family history, so she's got to do it a little more regularly. And so she goes in and she's like, I'm a cash pay customer. And they're like, oh, great. We'll give you a 50% discount for just paying in cash. And so she got her mammogram today for like under $200. I think it was like $200, something like that. Whereas the health insurance plan would have paid somewhere between $500 and $600 for the exact same thing. Another one that was so interesting is I about a year and a half ago was having chest pains, and so I went into the cardiologist and he said, "Hey, will you please do a stress echo test for me?" And I was like, "Great, how much is it?" And he's like, "Oh, your cash pay, that'll be like $200 plus or minus 50. I don't remember exactly what the number was, but it was like around $200." And so I put this thing on Twitter and I said, "Hey, I just got my stress echo and it was $200, and that's an awesome price." And a guy reached out to me. He's like, "I just did a stress echo with my health insurance plan. It was $5,000. I paid $200 for the same stress echo that he got for $5,000 with a health insurance plan." I'm like, like it's mind blowing
Mind blowing.
that you can do this. A colonoscopy with a health insurance plan, you can't get it under $3,500. We're doing colonoscopies all day long for like $1,200, somewhere between 800 and 1,200, depending on what state you live in. And so it's just like time after time. Labs, another one. Labs are
Oh,
incredibly egregious.
crazy.
I go get a full set of labs every year. And I always pay between 80 and $120, depending upon just what I'm getting that time of year. The same thing with health insurance is somewhere between 700 and 1,000 for the exact same labs. But since I'm paying in cash, I'm getting a way better rate. And so the bigger question is like, why is that happening?
Yeah.
Right. One is the health insurance plans. What do? They don't really go in and negotiate. They just say, hey, listen, a 5% increase this year seems reasonable. Nobody gets upset with it. But then 5% on top of 5% on top of 5%, people who understand math, that gets fast, that gets high fast. And so, so that's one reason. The second reason is if I go into a doctor's office, that doctor has somewhere between 2 and 3 billing people per doctor just to bill health insurance.
Oh, yep. Yep.
On top of that, they are also spending on average 15 and a half hours per week doing administrative tasks, fighting with health insurance plans, doing pre-authorizations and all these kinds of things. And so if I can go in and I say, hey, I'm just going to pay with a credit card or cash or whatever, that strips out all of that administrative bureaucracy. Like all the people in the middle disappear when I pay my doctor with a credit card. So he or she is way more willing to be like, yeah, like for sure, I'll give you a discount. And in fact, we get dozens of doctors every month reach out to us and say, please send us more cash pay people. Will you send them to us because we'll give you a great price because I'm tired of dealing with this health insurance craziness.
Yeah.
So those are some of the reasons why you can get way better deals if you pay in cash as opposed to buying services through health insurance. I always say it's like healthcare is not expensive if you pay in cash.
No.
Health insurance is very expensive if you pay with health insurance.
Yep.
So and people are kind of like, what? I don't understand that. But it's because you're ripping out all that bureaucracy out of the system. And so, we've seen this over and over and over again. In fact, our members for big bills, I think the last time I looked at it was like for bills over $2,500, we're getting 50% better prices than United Healthcare for the same procedures. And these
Wow.
are big ones. These are, ACL tears, Achilles, heart procedures. It's crazy. The prices you can get. I got tons and tons of stories that I could tell too on just that. I mean, they're nuts. The difference you can get.
Well, and I think like for the people that are saying to themselves, okay, yeah, that's great, but I'm still going to be paying more in cash than I would with my copay. If you when you look at the numbers and you iron them out and you look at both, you're still paying more at the end of the year, or you're still paying more at the end of the month because you're still paying your premium and all those things. So when you really look at the numbers, if you were paying upfront in cash and you have those discounted prices, you're actually paying less. I think that's where people's brains get a little shoveled around, is that they
Yeah.
can't really like grasp it until they really see it. But what's unfortunate is that they never really get to that point where they're like, let's look at how this actually works, which is why I so much wanted to discuss this part of it before we move into CrowdHealth. And the second thing I was going to say is that you actually went you took it right from me, which I love, is that I was going to ask you about the doctors, because I feel like so many doctors, or more and more doctors, are moving away. They're moving away from health insurance. I mean, I was just telling you off air that mine actually like dropped my PCP before I got rid of my health insurance, dropped me off of her
Yeah.
practice. And to be honest with you, I can't really blame her, because it's just such a pain. And I feel like they're probably burnt out. They're probably just over like fighting, and like you said, the administration and all the stuff that goes into like trying to get paid, and that probably takes 2, 3, 4, gosh knows how. I mean, I don't even know how many months that could take for them. They're so over it, and I feel like it would just
Yeah.
simplify and minimize things so much. And also, the relationship between the patient and the doctor probably improves. I'm sure you can speak to this a little bit when you're not an insurance quote unquote customer, member, or whatever you want to put it.
Totally. 100%. I mean, just that stress echo test I just mentioned, my doctor was like, "Hey, if you were with health insurance, I would have called you back into the office so that we can discuss the results. But since you're a cash pay, can I just call you and I can just tell you?" And I was like, yeah. I mean, the last thing I want to do is, basically take a half a day off to come back in here and sit in this office with a bunch of sick people. That's the last thing I want to do. And so if he'd call me, and so he called me, he's like, everything's normal, everything's fine. So yeah, the problem with the doctor patient relationship is, with health insurance, there is no doctor patient relationship,
Nope.
because, what I say is, you work for whoever pays you. And doctors are paid by health insurance companies. Yes, there might be a hospital in the middle, or whatever, but ultimately the doctors are getting paid by health insurance, and they can only do what the health insurance plan says that they can do.
Yep.
Um, and so when you go in and you pay with cash, you now are the customer. And now it's between you and your doctor. You rip the government out from in between. You rip the corporation that you work for out from in between. You rip out the insurance company, and now it's right between you and your doctor. And so, one of the biggest pieces of feedback with our members is like, "Wow, like the doctor actually like cares now." And I was like, "Yeah, they care because you're the one paying them."
Yep.
It's and so it just changes the whole dynamic. I think the other thing too within the kind of the health insurance system is, these doctors only have like 8 to 10 minutes with you. Your primary care doc, I think, is on average spending about 10 minutes with you. And that's impossible to get to core issues when you only have 10 minutes. You can't talk about your lifestyle choices. You can't talk about what you eat. You can't talk about how often you work out, all of those things, which are, I think, the core of, what makes somebody healthy or not healthy. And so what do they have to do in those 10 minutes? They have to figure out what the symptoms are. They have to figure out what drugs to put you on so your symptoms disappear. And, they don't have time to get to the core root issue of what's going on with you. They just address symptoms as opposed to the core root issues. And so I think some of our, chronic disease, I saw a stat the other day that 70% of people go into Medicare with at least one chronic disease. And it's somewhere close to 20% of people on Medicare have six or more chronic diseases. And so it's like, why is this? It's because we haven't taken care of the core issue in your 30s, 40s, and 50s. So now that you're in your 60s, 70s, and 80s, you're seeing decades worth of your body just getting hammered by something that could have been taken care of, 2 or 3 decades earlier. And so, one of the things that I always say to my team is like, look, I want to have CrowdHealth members who age so that when they're 80, they can still be playing wiffle ball with their grandkids in the backyard. Like
Right.
that to me is thriving. I want people to, what I kind of say is like, live life hard and die fast, right? Like I want
Yeah.
to die in my sleep because
Yeah.
my heart gives out on me or whatever because of
Yeah.
old age, not in a nursing home or in hospitals or whatever for the last 4 or 5 years. And I think we've got to make some changes in our 30s, 40s, and 50s so we don't deal with that in old age. I think ultimately that's what corrects our system is being able to rid ourselves of some of these chronic diseases, which are the vast majority of them, 80% of them are lifestyle related issues.
Absolutely. I mean, that's really the premise of this whole show, right? Is just that's what we talk about in general. It's just root cause versus sick care management, which is what healthcare, especially in the US, I mean, is really all about. And you just opened a whole another door. Like we could totally go down that route, which we don't have time for. But the reason why the prevention is not spoken of. The reason why all of that, those avenues and true care, right? True care is not being had at large is because that means that you would be not stuck in the system. So then you wouldn't be under the thumb of the insurance. Then you wouldn't be under the thumb of big pharma. Then you wouldn't be, but that's not how this works, right? The prevention is not what they're after. They're after like the sick because that's where they can control you. It's where they can keep you and that's where they can make the
Yeah,
most
totally.
money. Yeah,
Yeah.
it's
I mean, you're seeing pharmaceutical companies right now with kind of RFK and they're going, they're freaking out because, we want to reduce our reliance upon pharmaceuticals and instead, get healthy and that means that it hurts their bottom line. I think Pfizer or somebody was down like 13% that the day that RFK got nominated. So it's very, very clear that they're going to have a tough time over the next 4 years, reaping the rewards of keeping people sick. And I think the system in general and us as human beings will benefit from not a reliance upon pharma, but a reliance upon looking back at our lifestyle choices and maybe making some different choices. I mean, I know it's a whole like rabbit hole we can get down, but like I feel like I'm seeing it. Like just
yeah.
even within my family, within some of my friends, even my employees, like there is a renewed sense of like let's focus on our own health. Like how do I get healthy? They're asking the questions. And so I was like, man, that's great. If nothing else, we're at least starting to have a national conversation around how do we actually get healthier, which I think is a super valuable thing.
Yeah, it really is. And it kind of points to the whole, again, this we could go down this road too, is I feel like when people are also kind of more, I don't want to say responsible, but say you're not, you don't have a traditional healthcare plan and you're sort of in this like for example, maybe you're part of a company like yours or you're cash pay or whatever. You're also looking at your path differently. I think that patients like this are actually better patients because
Oh
they
yeah,
really are looking at the whole entire thing and they're taking their health more seriously. And I don't want to put everybody into that same basket, but a lot of unnecessary protocols, procedures, surgeries, medications are given through this like whole insurance, the whole thing that are unnecessary. And people are just, okay, this is what I do. Okay, this is what I go in for. Okay, here's my
hmm
routine,
hmm
which maybe that might make you like pump the brakes a little bit and be like, do I really need this routine thing? Or do I really need this? I mean, there's like a critical thought process that I think takes place when you are starting to take more accountability and like pull yourself
totally.
out of this paradigm, right?
Yeah, totally, 100%. And like I said, I'm seeing it. I'm seeing it within our community. Our community members are, they're responsible for their own bills. I mean, sure, we've got some mechanisms to help them, but they're ultimately responsible. And so when you're responsible for something, you pay a lot more attention to how much things cost and things like that. And so we're absolutely seeing it. We had a guy with colon cancer. It was a crazy story. He went in to the ER with kidney stones, and as they were, looking at his kidney stones, the doctor was like, "I think I see something under your colon. You better go get that checked out." So I had a colonoscopy, stage 2 colon cancer. And I joked with him, so he doesn't mind me saying this. I was like, I think you're the only guy on the planet that celebrates having kidney stones, like because it saved his life. I mean, if he
Yeah.
wouldn't have gotten that, there was no family history, and so there's no reason for him to go get colonoscopies. And so that colonoscopy or that colon cancer probably would have killed him because it would have caught him too late. And his response was like, "Yes, I have colon cancer. I want the best docs, but I want you guys to help me find really, good docs at reasonable prices because I don't want to screw up the rest of the community, and we can talk about CrowdHealth, when
Yeah,
you're ready, but like
we're
we have a
going there.
community of people who are helping each other fund each other's healthcare expenses. And so you've got this community. And so you're actually hurting other people directly. Whereas, if you go and do all these crazy procedures or whatever with health insurance, like it's United Healthcare who get hurt. It's not another human being who's actually getting the wrath of your really bad decision making within healthcare. And so we're actually seeing some behavioral changes within our community, which I think is really really cool.
That is
Yeah,
cool.
very very cool to see.
That is awesome. It is awesome. It really is. I think it changes the game for people just mentally, emotionally, and then obviously how they physically, the physical actions, or I should say the decisions that they're making in their life and for their families. Let's jump into it. I want you to share with all of us. And I am, like I said, I am pretty now. I feel like I'm sort of well versed in it because I am a new member. But I think that you explain it so much better and so much clearer. Okay? What is CrowdHealth? Why is it not a typical insurance company? And then we can kind of go into what you're responsible for, what you're not responsible for, and how the crowd helps you pay.
Sure. Yeah, as I mentioned before, like our whole foundation is enabling people to pay the doctor directly without the doctor having to go and bill health insurance. So, if you have a big health event, we've got nearly 10,000 people now in our community who have kind of stepped up to say, "Hey, I'll help. I'll help if somebody else in the community, gets hurt." And so, if, Vanessa goes and breaks her arm and it's $5,000, then we ask Vanessa to pay the first $500 of that. And then we'll send the remaining $4,500 to the community members just to make math easy. Let's just say we're asking the community members $100. So we'll ask 45 people for $100. And if they say yes, then we use whatever payment method they have on file. We'll take out $100 of that. That $100 will go directly to Vanessa. So at the end of the day, when 45 people say yes, Vanessa has the $4,500 in cash that she can then go and use to pay for her broken arm. Now, I say, they can say yes or no. So this is kind of the interesting component. It's like, why would somebody say yes to Vanessa? I don't know Vanessa. No offense, but like your broken arm is not like the heart
Yeah.
tugger, that might gets me to do it. But when Vanessa submits her bill to the community, we see the last 10 times that Vanessa's been asked by the community, has she said yes, 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 yes to community members, or has she said no, 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 no? And if she said yes, 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 she's a good community member. Like she wants to help the community. And so when, she has something going on, she is hoping that the community is going to help her back. 100% of those bills have gotten funded. Now, if Vanessa had said no, 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 people will see that and be like, wait a second, like, why would I help Vanessa when Vanessa is not willing to help anybody else in the community? And something like 10% of those bills get funded. So there's this reciprocity engine within our community that's like, hey, help somebody else out in the community, unless they just, have been bad community members. In that case, you don't have to help them out. So that's kind of an interesting component of what we do as a community of people. So we've done something like 20,000 bills plus or minus over the last 3.5 years that way. 99.8% of them have gotten fully funded. The
Wow.
0.2% that didn't get funded are the people who are the takers and not the givers. And these have ranged from, tiny pediatrician bills to we just had a guy who, accidentally shot himself, one bullet, six holes, bullet through the chest. And that one is approaching, approaching $1 million. It might have hit $1 million by now. And that has gotten funded. We've had dozens of cancer cases, as I mentioned, colon cancer, breast cancer, non-Hodgkin's lymphoma, some really, nasty, cancer cases. And again, we only ask our members to pay the first $500 of that. And then anything else for that health event, we'll submit to the community for funding. So if you have non-Hodgkin's lymphoma and you have, meds and you've got hospital stays and you have surgeries or whatever, all of that is considered one health event. So you pay the first 500, the rest is submitted to the community for funding. And I only ask everybody in the community once, maybe twice per month to help somebody. So I'm not asking you every single day to help. And you can automate your response and you can say, hey, anybody who has been a good giver to the community, I'm automatically going to say yes. Or you can do it manually and say, yes or no on the email that we send you. So That's how it works. It's worked, beautifully for, 20,000 plus or minus bills.
Okay, so that was awesome. Thank you for explaining that. I actually now even further further understand it just based off of that. Even though I've watched your video and things of that nature, and I've read the whole guide. Which, by the way, that guide is so easy to read. I'm like, wow, this is
We
probably the
try to make it
easiest.
fun.
Yeah, it was like the easiest guide I've ever read. But I feel like for people who are just like, okay, like that sounds cool and all, but like I just want to know dollars and cents, like what am I responsible for per month? So can you
Yeah.
explain how there is a member fee and then the crowd funding fee and then what that cap is? Because people are probably like, oh my gosh, so you're telling me that I might be paying like, $700 a month to fund the crowd? Like, no, that's not how it works.
Yeah. Yeah. So you basically pay a subscription fee. And that's $55 a month. That goes directly to CrowdHealth.
Yeah.
Um, and the reason why we do a subscription fee is to not get into some of these perverse incentives that we have talked about before. So, it actually hurts us if you don't get a bill paid because you're going to go on social media and you're going to say, I can't believe that CrowdHealth wouldn't, to pay my bill. Like that doesn't help me at all. That hurts me.
Yeah.
And I want more people in the community, so I get more of those $55 per month. And so I have an incentive to grow the community. I have an incentive to fight for your bills to get paid as opposed to fighting against you to get your bills paid, right? Like the health insurance plan generally does. And so that is to make sure the incentives are aligned. So the anniversary day of when you join, so if you join on the first of the month, every first of the month, we're going to ask you for $55 per person. And then some point throughout the month, if you're a single individual, we're going to ask you for up to an additional 140, and that money goes directly to somebody else in the community to help them. So for an individual, you're maxed out at 195 a month. We're not asking you for anything else. That's how much we'll ask you for in any one month. Now I say max because that 140 is the maximum we'll ask you in that month. We only ask for what the community needs that month.
Mm-hmm.
And so, for example, in February, we're only asking for 80 of that 140. And so we're asking for whatever that is, just over half of what we say your max is, because the bills right now are so low within the community that those additional dollars that we're not asking you for, the $60 that I'm not asking you for is yours. You get to keep it. We're not going to ask for it. It's, you know, go buy a ribeye, do whatever you want with it. We don't care.
Yeah.
And so the cool thing about it is if the community does well, all of our members do well. Whereas if the insurance plan, if the community does well, the insurance plan takes that profit. For us, it's you all keep it. And so that's the neat thing about that. So it's we'll ask for 140 if you're a single person under 55, 280 if you're a single person 55 plus, or 420 if you have a family of four or more. So just to give you a sense of this month, we're only asking 80 for single people, 160 for singles at 55 plus, and then 240 for a family. So 240 of that 420. So our families are saving almost $200 a month this month because our community is doing so well. So
It's so cool.
it sounds complex. It's not.
It's not.
Once
Yeah.
a month, it's a subscription fee. Once a month, we're asking for up to 140. And we tell you at the beginning of the month how much we'll be asking for about. So on February 1st, we went out to all of our members and we say, hey, it's $80 if you're, single. And so it's $80 plus or minus a couple bucks, just depending upon how the bills come in. So it's a super easy thing. And again, where we do that because we want you to have the excess capital and not us. So there's no incentive for us to try to, goof around with the bills to make sure that we profit as most as we can. It's the opposite of that. We are totally aligned with our members in that structure.
Yeah. Yeah. No, that's so I'll give myself just as an example, just for anyone who's like further curious or wants to hear exactly how it worked for me. So like Andy said, you guys, it's $55 per member, right? So in my household, we have two members. So 55 plus 55 is 110, right? And then we are under 55. My husband and I are both under 55. And so that would be up to 140, right? Per person per month. So which would
Mm-hmm.
come to 280. So that 280 would be the max that you would request ever. For the fund plus our two membership fees, which is 55 and 55. So the total that we would pay per month that which is not usually not always the case, right? It could be this or lower, would be 390. So
That's
just to
right.
give you an idea of how much money I am saving, so my health insurance for two adults, no children, prior to me joining CrowdHealth was $1,000 a month. So I went from $1,000 on an HMO plan to now 390 per month or lower. And will never be asked as long as I'm on, obviously that will change a little bit once I reach 55 years old. But so that's how much money I'm saving. And so I just wanted to provide an actual real life example for people that are listening, because I almost needed that. Like when I was asking your Jason, which is the rep that I spoke with, like he was giving me an example, right? So it helped me in my mind. I was like, oh, okay, I got it. That's a whole lot of savings for me.
Yeah.
It's just crazy. And so again, just to reiterate your point, it's 500. You're responsible for up to $500 per health event, whether that's like getting stitches and whatever, to something as large as like cancer or a heart attack or whatever. So
That's right.
because I feel like people are really real. That's where the fear lies, I think, right? Is like, what about
Hmm.
the catastrophes? What
What about
about
the
the
big one?
yeah, what about the big ones? So can you go into like how you would approach planned labs, appointments,
Hmm.
procedures versus say like a 911 event?
Yeah. Let's do 911 event first because
Okay.
it's a little bit easier.
Yeah.
So 911 event is if you go to the ER, like you go to the ER and typically you'll just tell them that you're a cash pay patient. They, by law, cannot treat you any different than if you have insurance. So there's a law called EMTALA. I'm not going to go into details of that, but basically it says you have to treat everybody the same regardless of whether you have insurance or not. And all the ER doctors that I've talked to literally have said, I have no idea if somebody has insurance or not. They don't even tell us that information so that we don't get into, EMTALA issues because the fines there are wickedly high. So they don't care. So you're going to go into the hospital. You're going to say, I'm cash pay. And one of the things that I tell people, regardless of whether you're crowd health, but if you're cash pay, sorry, getting on a tangent here, but it's really important. This is going to save people tens of thousands of dollars. There is a form called the personal financial responsibility form. So, you go to the hospital or you go to your doctor or whatever, and they give you this clipboard and you just fill out all these papers. And typically for me, at least historically, I've just been like, Andy Schoonover, date, Andy Schoonover, date. I don't really read them. I just kind
Yeah.
of go them.
Yeah.
One of those forms basically says you are responsible for the entire cost, regardless of what we charge. You are responsible for it if you don't have a health insurance that'll pay for it, right? So that basically gives them the right to charge you anything they want, and you now are responsible for it. So what I do is I cross through that line. I put a cross through that sentence, and I say I just put reasonable charges, and then I sign it.
Oh.
And that then gives you the ability to go in afterwards and say, no, 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 you have to give me something that is reasonable. So um, that's one of the things. And if it's on a clipboard or it's on an iPad, which some of these new, things are on iPads, on that form, I write don't sign or won't sign in the signature line. And like every single time it works. So, you just say won't sign. Anyway, that's a little bit of a side note, but
Oh, that's
to
good.
help people out there. But then they'll send you the bills after the fact. And then you get those bills. You go into our app. We have an app on the phone. You take a picture of the bill. We consolidate those on the back end, and then we'll negotiate on your behalf with the hospital to get those prices down. So we're seeing prices drop by 60, 70, sometimes even 80% by us just negotiating those for you. So, and the great thing about that is if you go to the ER and, in my case, I had this $17,000 deductible, and, that would be like wickedly bad,
Yeah. Yeah. Yeah.
versus with Crowd Health, it's like, okay, I'm on the hook for $500. I can do this. Like this is reasonable. I can take care of this. And so you can focus on your health as opposed to the financial aspects of this,
Right.
which I think is really important. So, and then once we negotiate it, we'll send it out to the crowd, fund it. You'll have the money then to go and pay the hospital directly.
Yeah. Yeah.
For the planned events, all we ask is for people to call us beforehand because all the crazy prices that we mentioned early in the show, they're going to try to charge you those, unless you let us negotiate for you up front. So if you want to go and get labs, I guarantee we'll be able to find labs significantly less. even at the exact same location that you would normally go to, but we can negotiate them down for you. If you have a bigger procedure like a knee replacement or whatever, like we can find you a really great orthopedic surgeon in your town. And so who's probably have seen a Crowd Health member before and has had a great experience. We know that they will give us a really great price. We know they're a really good doctor. We had a woman in Austin who tore her ACL and went to the hospital. The hospital sent her to an orthopedic surgeon. That orthopedic surgeon, because that's what hospitals do, they want to keep you in their system so they make the money.
Yeah.
They wanted to charge her $24,000, and so she called us and we're like, hold on a second, we've got a great orthopedic surgeon. So we found a great orthopedic surgeon who actually does some of the orthopedic surgeries for the University of Texas athletic program. So he's really good, and he did it for, I think it was like $11,000 or $12,000. So it was like half the price. And so all we ask is for people, and in that case, what happens then is we go and crowdfund it. We can usually get you money within like a week and a half. You then have enough money to go and pay the doctor at the point of care. And that doctor, now that they're getting paid at the point of care, is giving you a way better rate than if he or she has to go in and get the health insurance billed. So in a TLDR, if you go to the emergency room, send bills afterwards. If you have something big beforehand, you just call us and let us know what's going on and we can help you out. One key thing to this though, and I hated when I had to deal with health insurance where I would call the number, I'd have to wait for 20 minutes to talk to somebody. When I talk to somebody, it's somebody in India or something. Like I have to tell them my life story, and then they're like, "Oh, I can't help you with that." And so they punch you to somebody else, and you have to do it again. I was like, I hate that crap. And so within Crowd Health, you have a care advocate, an individual person that you are assigned to when you sign up, and you can call that person, text that person, email that person, and that person is going to respond directly back to you. Now, if you have a big event, we pull in some other people to help, but like that is your point of contact. They get to know you, they get to know your family, they get to know your condition, whatever's going on. And so you feel like you actually have like an advocate within Crowd Health to help you walk through, oftentimes stressful healthcare situations. So that's one of the cool benefits of Crowd Health is having somebody who's on your team internally who will respond to you. And so that has seemed to work really, really well over the last few years.
That was actually one of the biggest things that I really, really liked when I was investigating Crowd Health is that exact thing. Like having an advocate that you can build a relationship with, who knows you, who potentially gets to know your history or whatever, and that it's the same person that you're talking to and that they're so readily available. Like that's the thing that I think that drives me the most nuts. Like you said, is like trying to get a hold of somebody or trying to get a call back or trying to, it's like that kind of stuff. Nobody has time for that, and it's so
Yeah.
frustrating. And then the people on the other line that are just in customer care, they don't care about you at all. Like they're not there because they care. They're there because they're getting paid and they really have no connection to you at all. So I really liked that. Um,
Can I just tell you a quick story around that because I think
yeah,
it's
please,
worthwhile. I
please.
mean,
Yeah, go for it.
we had a little guy in Colorado who was hiking with his dad, and he fell off the rock and he hit his head and he had to have his stitches. And so, as the care advocate was talking to the parents, they're like, "Yeah, he's just really not sure about going hiking anymore because of this little thing." And so, one of my care advocates sent him like a little a toy that was like a little climbing toy where it's
Oh,
like 3 feet high, and he gets to climb up it, and it's got like those little grips on it so they could with a little note that says, "I hope this helps your little adventure get back out onto the mountain." It's just
oh,
like one of those things you're like, how
that's
cool is that?
awesome.
And
Yeah, so personal.
so the mom was like, in tears. I get emotional talk about it because it's like our advocates like truly care. And actually, when I asked my team, it was about 6 or 9 months ago, I was like, "Hey, what differentiates us versus anybody else?" And somebody set up is like, "We legit care." And I was like, "Yes, like that's really it. Like we legit care about our members." And I think you'll see that with us if you join us. So it's really a cool thing to be a part of.
I felt that when I heard you, speak on Dr. Ben's show. I thought to myself, just from a discerning standpoint, like these people are really in it for different reasons. And, and so far, like I said, I have only been a member for a couple of weeks, but when I was talking back and forth, because I actually had, it was my fault. There was actually like an inputting error that I had done when I signed up, and they were so helpful and so responsive between the two of them. And I was like, wow, I mean, these people are really like they actually care about the fact that like I'm over here trying to, I was a mess. I don't even know what was going on that day, but just like I had like two errors in my little application, which is basically not that big of a deal, and I had just screwed up, and I'm like, wow, to get this kind of help this early on is it's not every day that you come across people that actually care about what's going on. I have like if we have a few minutes, I have a couple or a few like I can sort of just throw them at you real quick, like
Sure.
sort of frequently asked questions or questions that I was coming up with, like if I were listening
Yeah.
to this show. Um, can people stick with their own doctor? Like if they already have a PCP as an example, or they have, a specialist, like do they have to like go elsewhere or negotiate or contact you, or can they stick with the people that they have?
Yeah, stick with the people you have.
Okay.
And all we ask is again for the big ones, like if you got like an orthopedic surgeon or whatever that you like, then just call us and let us call them and be like, hey, can we get a discount if we pay, if our member pays you directly and things like that. So just call us before you go and get one of those big surgeries. But yeah, primary care. I know for my wife, like whenever I changed health plans, she's like, is my gynecologist, oh, my
Yeah.
OB/GYN, because we were in that baby kind of stage, right? And so she wanted her OB, as a part of that. I was like, with CrowdHealth, you can go to anybody you want. We don't really care. And if you're into kind of like integrative or naturopathic or holistic or things like that, you can go to those doctors too. So we want you to go to wherever you feel comfortable to resolve your issues.
That's awesome. Um, can you talk really quick? Because this was a question that I had for, or prior to signing up, was that can you quickly explain how prescriptions work?
Yeah, but we have a prescription card in our app. So yeah, you just go in our app. It's got a prescription card, and you can take it pretty much anywhere, and you can get much less for prescriptions than you would otherwise. We also have GoodRx, which we direct people to. So you can go to GoodRx, and you can usually get really great discounts on GoodRx as well. And for some of the big ones, we actually can go directly to the manufacturer. So we had this woman with non-Hodgkin's lymphoma, and her monthly bill for her med was going to be $40,000. Um, and so we reached out to the manufacturer directly and got that negotiated down to $2,500.
Wow.
So
What?
that's a 95% discount or 92% discount or something like that by just going directly to the manufacturers. But again, that tells you between the manufacturer and the pharmacy, all the people in between who are taking their little cuts. I call them rent seekers. They're just like they want their little piece by just being there.
Yeah.
And so yeah, prescriptions are way less if you pay in cash. And so if you have cancer, as I said, there could be doctor visits or labs or surgeries or whatever. Prescriptions is included in your health event. So
Oh, okay.
again, you just pay the first 500, and the prescriptions are included in that health event.
You know what? It's funny because the whole, I'm not, this is really perfect for like our household because we pay cash for we were paying cash for most of the things that we do like preventative health and things like that anyway. So but we do or we do slash did what I don't know what I'm going to do yet, but we did have a or do have a primary care physician because both of us take one. It's not really considered a med. It's Armor Thyroid, right? So both of us
Yeah.
take that for thyroid support, but it needs a script.
Hmm.
And so one
Mm.
of the things that was kind of like holding me back from, oh, well, I'm going to be paying so much more for the prescription was that, right? So when I was talking to J- Jason, who was the representative that I was talking to when I was going to sign up, he was like, well, what's the script that you have? So I told him, and he goes, let me look it up real quick for you. Oh my gosh. It was like $28.
Yeah.
And I have paid more than that through insurance. And I thought to myself, it was either the same or less. And I'm thinking, oh my goodness, here I was thinking like, oh gosh, it's probably going to go up, even though it's a discounted prescription card. And I'm like, no. And even the funnier thing was is when I went to the pharmacy to pick it up, I was like, hey, just so you know, I have to, I canceled Blue Shield recently. I need to make sure that you guys don't have that in the system anymore. And they go, no, we already have this new prescription card in the system. And I go, but I didn't give it to you. And they said, no, we have it. We looked it up. We looked you up, and that's what came up. And so I was like,
There you
you
go.
already have it in there. And the same exact thing happened to my husband last night when he went and picked up his. Yep.
That's amazing. I mean, what I would say is like, if you're not yet a member of CrowdHealth, one of the big questions that people have is like, what about previously
Yes.
diagnosed,
Yes.
conditions, right?
Yes.
And that is one of the barriers for people where, we asked you to be a member of the community for 2 years before you can submit your previously diagnosed stuff. So if you have to have a knee replacement, and you come in and you want people to pay for your knee replacement, that doesn't work. And the reason why is because really early on, we had people who needed a hip replacement. They jumped in, they got their hip replacement, and they jumped out,
They
right?
bailed.
And we're like, we can't do this way. And so, but I would say that we've got a lot of people with like previously diagnosed conditions because the medications are way cheaper than, by paying in cash, and you're saving so much money that it's worthwhile paying for your $20 thyroid or
Yeah.
your $10 blood pressure medication or whatever it ends up being, right? Like the things that you're taking, and you can pay for those things directly. You're still saving so much money.
So
My
much
family
money.
saved like $15,000 last year. Like, don't look at it as my health insurance plan is not paying for it anymore. Look at it as like I'm saving all this money, and now I can use that money for whatever the heck I want, as
Yeah.
opposed to only what the health insurance plan will pay. So we've actually have a number of people with type 1 diabetes that joined us, and they're like, I'm saving so much money, and you guys can find my insulin and all my supplies for me much, much less than, my health insurance plan. So I'm just going to join Crowd Health and be on it, even though they have type 1 diabetes. And we're like, awesome, come
Wow.
join us. And so this is not to try to keep people out. It's really trying to keep, what we've built as a community thriving. And we can't do it when people just jump in and jump out and things like that.
It
So
makes sense. It makes
before you
sense.
join, just make sure you read that previously diagnosed condition. And the way we think about previously diagnosed is we have a 5-year look back period. So if you've had something happen in the last 5 years, that would be considered previously diagnosed. If you had cancer 10 years ago and you joined today and you got a recurring cancer tomorrow, that would be eligible for funding because we only have a five-year look back. So,
Gotcha.
I mean, we can't say, when you were 2 years old, you had something and it popped back
Right.
up again.
Yeah.
That's just not right for the community. So
Yeah. No,
again,
thank
we've
you.
been doing this for 3.5 years. It's worked out really, really well. And it does eliminate some people from doing it. The only other thing is if you're a smoker, it doesn't work. And if you are kind of obese, it doesn't work. And so we've got some limitations there. But otherwise, we'd love to have anybody in the community.
Yeah, that was gonna be my question. So thank you for covering that, and also the pre-existing was gonna be that's a big because I had asked that too. Not that
Yeah.
not that have like these. Like I said, I don't really go to the traditional doctor, but there was a pre-existing script because I had been like low on, or I had some issues with thyroid and my husband did as well. And so I knew that, but then that's easy. Like I said, it was like,
Yeah.
I would be responsible for that anyway. Right. Like up to whatever. And so, yeah, it was
Up to
something
your
nice.
deductible. Yeah.
Exactly. Exactly. Okay. Quickly before we tie up here, is there anything, oh, could you talk really quickly about the annual or the sort of the wellness, the
Oh yeah.
$300 wellness event per year?
Yeah, I mean, ultimately, we want people to go and do their preventative stuff, right? Whether that goes to your gynecologist or your pediatrician or your primary care doc, or for me, I just use it for a full set of labs. But you have one visit up to $300 that you can use for preventative. So if you go to your, primary care doc and it's $200, that full $200 is eligible for funding. If you go and do a full set of labs, which is $150, let's just say on the high side, you can submit that for funding, but you only get one of those per year, up to $300. The other things that are included in this also, though, are vision. So if you want to go and do vision, contacts, things like that, up to $300, or your dental, you can go for a dental visit. And so, my kids' dental visits tend to be at the upper end of that. So we use that for my kids. My wife's gynecology stuff is, on the upper end of that. So we use that for her. For me, mine isn't that expensive. I just do it for lab. So you get one of those per year. If you have a direct primary care doctor, so a direct primary care doctor is a doctor that you pay instead of like on a fee for service, like you go in and pay them. It's a monthly thing where you have access to that doctor throughout the year. We'll fund, the community is eligible for funding up to $300 of that too. So
Okay.
in essence, what we want to do is you have $300. You can use it for a preventative visit because we want you to go and see your doctor, every year if possible.
Yeah. Okay. Love that. Love that. And then my last question, because I feel like this is an important one to cover, is how does this apply for maternity?
Yeah. Maternity is the only one that falls out of that $500. So maternity, it's actually you're responsible for the first $3,000. And this is prenatal, labor, delivery, and postnatal.
Oh,
And so all of that is incorporated. So you just pay the first 3,000, and then the rest is submitted to the community. And so we did have it at $500 for a while, and what we found is people were coming in having babies and jumping out, which a baby is $15,000, so the math doesn't work. And so we were like, hey, you gotta own a little bit more of that. And we have a lot of babies. Actually, our number one expense in the community, the number one amount of crowdfunding is babies. So
oh,
I kind of say that we're really good at paying for bumps, whether it be baby bumps or the bumps and bruises from injuries, because those are our number one and two things that are submitted for crowdfunding. So about 70% of the funds go to those two categories, which I love paying for babies, and I love
yeah.
helping out people if they just have something bad happen, in life that just, you can't help. These are typically out being active and they have a mountain bike face plant or something like
Yeah.
that,
Yeah. Yeah.
I'm
Yeah.
happy to help out with those things.
And then
So,
if a
um,
mom if a mom were or a mom and a dad were to have like some sort of post birth event, say the baby ended up in the NICU, that could also be crowdfunded,
yeah,
correct?
yeah, oh, yeah, absolutely.
Okay.
Yeah. Some of our biggest bills have been NICU bills.
Okay.
So yeah, for sure.
Good.
The other only thing I wanted to say around maternity is you can have your baby wherever you want. We don't care if it's in the hospital, if it's at home.
Ah.
Doulas, midwives, those are all eligible for funding. A crazy stat. The last time I looked at it, it's probably a year old stat now, but it's probably the same. But in the United States, somewhere between, I think it was 1.6 or 1.8% of babies are born at home. At CrowdHealth, it's 40% of babies are crowded home. So we've got a
Wow.
lot of babies being born at home, which,
Love
I
that.
think is kind of cool. And just kind of shows you the type of people that we have within the community. They're looking at a different way of doing things that the medical community has said are dogmatic. So anyway, yeah, we're all about you having a baby at home or at a birthing center or wherever you want to do it. So there's no limitations around that.
Oh, that is so fantastic. That is so awesome. I love to hear 40%. That really does tell you a lot, right? About the members
It
and
does.
where their minds are at. Yeah, but I love it more than anything because that's where I sit. And that's also why having I'm going to use the word scam because that's how I feel about it. Like a scammy health insurance plan for way too long, it didn't fit within how I live my life. It didn't fit with my,
Hmm.
belief system, my morals and values and all the things. And when you start to really uncover and learn about how the system works, you realize that it's not there to benefit you and you're not really winning the way you think you're winning. So,
Yeah.
yeah, that's amazing. I feel like I covered all of the big things, but I want to say and share with you guys, if there are questions that I missed or that, Andy and I did not cover, then it's super, super simple to get these answered. I went on and just scheduled like a quick call with one of his advocates, one of his team members, and he answered all of the questions for me in like a 15-20 minute call. And I probably kept him on, just because I had a couple extra questions, but it was super easy. So, and I think like I said, your guide is pretty, or I should say the frequently asked questions in the website is helpful as well. I went there and I just feel like everything is spelled out and easy to get the answers to. So if you did not hear something that you want to be touched on, I'm sure, you can reach out that way. And all of this, actually, why don't you tell us where can people find more about Crowd Health and find, yeah, just if they are interested in learning more, where can they go?
Yeah, joincrowdhealth.com is our primary webpage. And then all the social media platforms were Join Crowd Health. So you can kind of get a lot of information there too. And if you want to reach out to us on any of our social media platforms, we respond, fairly quickly. Yeah, and if you go to joincrowdhealth.com, on the bottom of the page, there's a little calendar that you can just pick a day and pick a time and schedule a time with one of our member advisors. And either Grant or Jason will reach out to you and have a conversation and answer all those questions. So they're both awesome. I think you'll enjoy the conversations if you have questions.
Yeah, that's what I did. That is what I did. And all of this information will be in the show notes for you guys. And I will say that there will be a link also in the show notes where you can go directly to it. And there will also be look for like a personalized code. So if you're a listener of this show, you can actually go and use that code and sign up with that code. So and that will be all listed, right, Andy? Am I getting that right?
Yeah, and if you use that code, it's $99 a month for the first 3 months per person, all in $99 a month per month for the first 3 months. And so this is to give your listeners access to for $99, you might as well try it, right?
Yeah.
Give
Oh
it
my
a
gosh.
whirl, see if you like it. And if you don't, you can cancel anytime. So it's not like a year-long commitment. You can start anytime, you can cancel anytime. And so we give this code out to people just to, hey, give us a try. If you like us, awesome. If you don't, that's okay too. But it's a low-cost way of giving this dipping your toe in the water to see if you like it.
That's fantastic. Yeah. So that will be the code and the link will be in the show notes for you guys. And again, if you have any trouble finding any information or, you're a little bit, you just have questions, don't hesitate to reach out to me personally. Or like I said, you can, get to Crowd Health via social media or their website, schedule a call. They'll get back to you. They got back to me so quickly. I had absolutely no problems. So again, all of this will be listed for you. Andy, it has been such a pleasure. Thank you so much. I have been so excited about this episode because I just feel like when I found Crowd Health, it was like I told you, it really was such an answered prayer. I had been just almost feeling desperate. Like, what am I going to do? This is so unaffordable for me. We don't use we're not even if we did use the doctor a lot, this would still be a better option, but even more so, like it's like we were not really using it, we were throwing all this money away and it didn't make sense for us, and I really had a pit in my stomach about it. So I'm just so glad that we were able to have this conversation and be able to share with people that there are other options out there besides these like quote unquote big box companies. So thank you for just sharing everything with us, spending your morning with me. It's been a real honor.
Yeah, well, thank you so much for joining. One, being a crowdy, as we call them. And thanks for having me on. It's been a lot of fun.
Yeah, it's been amazing. All right, my friends, thank you so much for joining us today. I will see you on the next episode. Have a blessed rest of your day and week.